Hi, I'm Marv Roy Lapasa, third-year medical student from the University of Cebu School of Medicine. Today, I will be demonstrating how to properly do the anatomical surgical hand scrub procedure using the brush stroke method. Of course, this is a vital step before every operation to maintain the sterility in the operating room. The whole procedure, when done correctly, will last about 3 to 5 minutes. First of all, remove all jewelries from the hands and arms. Then inspect your hands and nails. Make sure your skin is free of any cuts or wounds, and your nails should not extend past your fingertips. Nail polish, if you have any, must be intact, without chips or scratches. Acrylics or artificial nails and nails with foreign bodies are not allowed. Let's now begin with the scrubbing procedure. Open a sponge of your preferred hospital-approved antiseptic, either chlorhexidine or betadine. Set the sponge aside with a tear facing the ceiling. If hands are visibly soiled or if it's the first case of the day, you should pre-wash your hands using regular soap. Using a disposable nail pick, clean under fingernails under running water. Rinse arm and forearm. Now you can start scrubbing. Moist the sterile surgical sponge with water. With fingertips together, use light but firm pressure and stroke the nails in a back and forth motion with the abrasive brush side of the sponge for approximately 30 strokes. Take note that the abrasive brush side of the sponge is only used for the fingernails. Now turn the sponge to the non-abrasive side, and with fingers together, scrub surface of hands for 10 strokes. Then turn hand over and scrub the dorsal area of your hand for 10 strokes also. Then another 10 strokes in the outside surface of the thumb. Continue scrubbing 10 strokes on the other side of the thumb and the side of the remaining fingers. Note that once you scrub an area, do not go back to that area. Now let's move on to the forearm. In scrubbing the forearm, we divide it into 3 areas, from the wrist up to 2 inches above the elbow. In each area, brush 10 strokes for every side of that area. When done, repeat the entire procedure in the other arm. When finished, dispose surgical sponge. Start rinsing from your fingertip and continue moving forward to your hand, forearm, then elbow in one forward direction through the water. Remember to always keep your elbow at a right angle with the hand positioned above the elbow. Do not move arms back and forth in the water. If additional rinsing is needed, completely remove arm from the water stream and start rinsing again from the fingertips towards the elbow. Your arms are now sterile, so avoid touching any objects until you get inside the OR. If you happen to touch any non-sterile surface or objects, scrubbing must be done again from the beginning, using a new sponge. To avoid contamination, keep hands above elbow and away from scrub suit and non-sterile surfaces. Walk backwards through the operating room door. Dry hands and arms with a sterile towel again from the fingertips to the elbow. Then the other tip of the towel for the other arm. Then proceed with donning of sterile surgical gown and gloves.